Welcome to Legal 123s with ByrdAdatto. Legal issues simplified through real client stories and real-world experiences. Creating simplicity in 3, 2, 1.
Welcome back to another episode of Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, my co-host, Michael Byrd.
Thanks, Brad. As a business and healthcare law firm, we represent clients in multiple sectors and multiple specialties, especially healthcare. Mm-hmm. This season, our theme is Specialty Spotlight, where each episode we will visit about some of the nuances that can be found from a business and healthcare perspective in the various practice specialties.
All right, Michael, it's your turn. What's on your mind?
Well, when prepping for today's guest, I started thinking about all the great lessons we've learned over the years about business leadership. We talked about on past episodes, we've mentioned Robin Pugh, our strategic advisor. In fact, I think we just had him reference him a few times ago, and then we've had him on as a guest in season 2. Yeah. And I get so much energy and love learning from teachings from lots of people, ranging from Robin to the more known people like Brene Brown and Simon Sinek.
Yeah, and don't forget, we've had other books that we've read that you and I have liked. I think Patrick Lencioni, he's written a bunch of books that you and I have read over the years. One of our favorite books of all times, one of our past podcast guests, Stephen Harvell, he wrote a book called 21 Secrets of $1 Million Sellers. And you and I have been and continue to be obsessed with that book.
Yes.
In so many different ways.
So fantastic, especially anyone that wants to really hone in on sales stuff, or for us, it affirmed a lot of the stuff that resonated that had been working for
Absolutely.
us. But the real reason I started thinking about all this when thinking about our guest today was the famous commencement speech given by Admiral McRaven at the University of Texas several years ago.
Yes, the Make Your Bed speech.
Yes, you got it. I mean, as you know, my wife Stephanie and I actually use this on our kids. I'm sure that they have fond memories of that. But, for those that haven't heard it, this is a Navy SEAL giving a commencement talking about changing the world. And he gave 10 basic life lessons based upon experiences learned as a Navy SEAL. And each of these, he pointed out, would enable you to change the world.
Yeah, and hopefully, Riley, let's see if we can find a link to it. We'll drop it in the notes so that the audience who hasn't seen it can definitely go listen to it. But, his first point, and that's why we said the Make the Bed speech, was if you want to change the world, you got to start off each day by making your bed. And his point is, if you don't do the simple things right, imagine how the hard things will go. And bonus prize, everyone, you accomplished something because you made your bed.
Yeah. One of my favorites, I love that one, is a lesson on having a bad day and perseverance. And he said, if you want to change the world, get over being a sugar cookie and keep moving forward. But what was really powerful was the imagery of what in the world a sugar cookie is in context to a Navy SEAL. And it was some exercise where, the trainees are put in an environment where they're wet and then having to roll around in the sand. And the point of the exercise is for the trainee to learn how to kind of push through despite being covered in sand and survive the rest of the exercises. So it's a really great lesson on perseverance.
Yeah. Now that we're talking about it, that does make me I'm gonna go back and watch it again.
Yeah, no, for sure. I did go back and start watching it whenever I started thinking about it, getting ready for the show today.
So I'm curious, Michael, what does all this talk have to do with today's guest?
Why did I think about it? Yeah. So the easy one is that we both went to UT. That was our common connection when we first started talking less than a year ago. We have mutual friends dating back to those days. And I know that our guest has a passion for workplace culture. And I think, these two common passions and the Admiral McRaven speech kind of immediately popped to mind when I was thinking about it. Right. And I'd be willing to bet that our guest has heard Admiral McRaven's speech. I think we've got to find out.
Well, first off, let's introduce who is our guest. Yes.
You don't want it to stay mystery the whole time?
No.
Oh, okay. So our guest today is Dr. Danny Clarke. He is a graduate of the University of Houston College of Optometry, undergrad, UT Austin, Hookham. He is an owner at Clarke Eye Care Center in Wichita Falls, practices with his wife, Dr. Elizabeth Clarke. He's also a licensed professional coach through the great game of business. He has a passion for helping the culture of practices and with business systems. And not only that, his kids, Caroline and Drew, both attend UT Austin. Oh, asterisk, we just learned before the show that his daughter just graduated a few weeks ago.
That's awesome.
Welcome, Danny.
Thanks, guys. Appreciate you having me.
Yeah, so we're going to put you in the spot right away.
Okay.
Have you heard Admiral McRaven's commencement speech?
I have heard it. Right when it came out, I listened to it, watched it. And then literally the other day, I was watching some Simon Sinek videos. We have a team event this afternoon, and McRaven was doing his Longhorns down the side of the screen. And I didn't click on it yesterday or the day before when I saw it, but I wish I would have now. But I did watch it originally.
Awesome. Well, you know, Michael, as he's introducing you, start talking about that you have this professional coaching side. Why don't you kind of give our audience some background on that?
Yeah. So, going back, just to give you some background, my dad's an optometrist. So I grew up in the business, and he started our practice in 1973. So as a kid, I would always work in the business, and we would talk about, so I was, 16 years old, and we'd stay till midnight talking about issues at the practice. And when we go around and teach other practices, and I'll get to that, kind of what we do with other optometry practices, but I always say, what do you think we were talking about? What do you think we were griping about till midnight? And every single time we've talked to groups, staff is the first word that comes out. And so first day I walk in the business, my wife is an optometrist as well. We had 8 staff members. Dad turns to me and said, he's in charge. And this was 1995. So I started running the business, and you can imagine what happened. It didn't go perfect from the start. It was like, I was trying to find the right people to get on the bus and the wrong people and get them off the bus. And I'd hire and fire. I tended to be fast to hire and slow to fire. And I started figuring out and thinking, I don't really like employing people. And my mindset changed. And I thought, I want to be a developer of people. I really want to figure out how I can make a difference in their lives, personally and professionally, whether they're in our business for one day or 25 years. And so with that methodology, we really started building a good culture in our business. And so in 2010, I heard about a great game of business. It's an open book management philosophy. It came from a guy named Jack Stack. It was actually a failing subdivision of International Harvester. It was for sale for $8.9 million. And he and some managers got $100,000 together, and he went to the first bank and said, I have $100,000. I want to buy this failing subdivision for $8.9 million. And they said, you're crazy. Where's your P&L? I don't know what a P&L is. Went to the next bank. Where's your balance sheet? He went to 53 banks, got an 18% loan in 1983. And through the methodology of, engaging your team, and they had to figure out, their critical number was, how do we pay off this bill? So they started playing mountain climber games and playing games within the business to make it more fun for the team members. They paid their loan off in 7 years. And then the story goes, they created a consulting business, wrote books and all this. It was mainly in the manufacturing industry. So we implemented open book management through Great Game in 2010. And the first year we implemented, we went up 1% in revenues and 47% in profitability. So we were hooked at that point. And I kid around and say the reason, how do you get to 47% increase? Well, it's because you're bad from the start. It's like ground zero. So anyway, but then about 2 years later, we started working with the Great Game people to teach some of our friends in optometry. And then my partner and I, her name's Jolie Anderson. She was the manager at the time. Now that she's the COO of Clarke Eye Care, and she's partners with me in our consulting business. And so for the last 10 years, we've been working with optometry teams around the US and Canada, about 350 practices. And we've extended that to a leadership development program because we found that there's people that really try to implement a methodology like this, where you try and engage your people to think, act, and feel like owners, but there's a base level foundational elements that are missing. And what those are is really giving people the opportunity to develop as leaders and putting systems in place for leadership development. So we have a monthly program we do, and our current clients, proud to say, 5 or 6 of them, most of them are signed on for another year, but we work with them. Twice a month, we go to their business, they come to ours, and I'm just real passionate about developing people within the business.
That's fascinating. Mm-hmm. I'm going to go back to 95 did your dad stay on after you were appointed the leader?
He did. And he just retired, actually, right when COVID hit. He retired. He's 75 at the time COVID hit. He was going to retire 6 months later, but he did stay on. So it was my dad, my wife, and I. Lucky for us, my wife was like, I want to see patients, but I don't want to do the business. So, we always talk about this three-headed monster kind of, or leader, and it worked out really well because they both stepped back and just let me kind of take the lead on that. And it didn't go perfect, of course, but he was there for, 20 years, 25 years later.
That's amazing. Yeah. Did you have a hard time, or did the staff have a hard time switching to you as the boss, so to speak, when your dad was still there and they'd been reporting to him for,
maybe a little bit back then? Now I'm the old guy in the business, but back then I was the young guy, and there were people that were, my dad's age. They're 25 years older than me. And then that was more probably hard on me than them. But really, to kind of have somebody who's 25 years older that you're having to say, hey, wait a minute, you're acting like a seventh grader. Let's get this together. But they really accepted it pretty well. I would say in our industry, the problem we have in our industry is that, if you guys ever read the book, The E-Myth with Michael Gerber, obviously you have. It's an amazing book. And what it really does
we're laughing because someone just recommended that to us on Wednesday. And we had not heard of it, but yes.
This was 25 years ago. And basically in our business, we're the technician. So we're doing the job. Then we're the manager, and then we're the owner. We're trying to do all these hats. And that was the classic way my dad ran his business. And so he ran it like everybody else did. And I saw that early on, and I was like, I do not want this business to be dependent on me. How can I create an organization that's not dependent on me? And I'm very proud to say now that I'm only in the business 1 day a week. It runs the team, 35 team members now. We've doubled the business since 2010. And, but the best part is our staff is really excited about developing other people within the organization. So we've pushed down that philosophy into the business. And we kind of like to talk about how we're really a people development factory. We just happen to check eyes. Rather than being, focused, what do you do? Well, we're focused on eye exams. No, we're focused on people.
That's really cool. So introduce the kind of, with that context, the technical side of what y'all happen to do. And love to just hear a little bit about the specialty of optometry. And I'm sure we're going to bounce back. We get drawn like a magnet back to this business leadership people discussion. I'm sure we'll go back there, but love to hear a little bit about just your discussion.
So optometry is a really interesting profession. Most people these days know what an optometrist is, and they kind of go, okay, yeah, that's somebody that checks your eyes. But going back years and years and years ago, Ben Franklin invented bifocals. Optometrists were really kind of within a jewelry store, basically, and just sell glasses. And so our professions changed a lot. 1973, my dad graduated school. He wasn't even allowed to put eye drops in the eyes to even check the health of the eyes. Our business has changed a lot. Now we have all these medicines we're prescribing. We don't do surgery. That's the difference with us. But there's a lot of interesting things with our profession as far as most optometry practices are about 50% medical and 50% retail. So if you think about, we're doing routine eye exams, we're checking for glaucoma, macular degeneration, diabetic retinopathy, dry eyes, cataracts. And then also we have glasses sales and glasses and contacts. So it makes it really nice when we think about recession and you say, oh, retail is going to be an issue or medical is going to be an issue. We sit right in the middle of both. And it's a very unique profession for that. It's really afforded me a lot of opportunities because if you think about, I don't have any formal business training, but I've always kind of migrated toward the business side of things. Most optometrists aren't formally trained in business. They just show up. They're an entrepreneur. And, I think I talked to you about this before, Michael, but, with my dad, I did an entrepreneurial venture recently that was like real entrepreneurial venture. But in optometry, I basically had my dad's business and I'm just tweaking it as I go along and thinking I'm an entrepreneur. But we like to say that most optometrists tend to own a job. They say they own a business, but they really own a job, and that practice dictates their lives. And that's where, going back, we've utilized people to really make a difference in their lives, and then it helps us live a better life. I remember that quote from Zig Ziglar when he said, the way you get what you went out of life is to help more people get what they went out of life. And as you guys said, you were right. I'm talking about the technical side of optometry and going right back to the people.
Just out of curiosity, these different groups that you consult with, what is the average size of like an optometry practice as far as like the number of optometrists that might be working there? Is it mostly mom and pops like you guys, where it's one or two people and that's it? Is that what you typically
so we have 5 doctors in our practice. My wife and I are both part-time, and then we have another part-time person, a couple of full-time people. I talked to one of our clients the other day. They have a solo practitioner with 4 staff members. And then we work with a practice that has 9 locations and about 100 staff, about 60 or 80 staff members. And so really and truly, though, if you think about optometry, there's a lot of vertical integration within the industry, and from payers, some insurance folks have gotten involved in that, and from the vendors are also doing that. So pretty passionate as well about private practice. So Brad, when you asked that about I'm going back to private practice optometry, solo practitioner is very common. What we're finding is, and I'm really looking at these days, is how do we keep the practice of private practice optometry sustainable for the future? And one of those things I'm seeing is that the practices that are mom and pops, one practitioner, it's very hard to run that business. And now we have companies like private equity firms coming in and buying up optometry practices for the quick sell. And it doesn't help culture, but when it's so hard for you to run that business, then you go, I'm going to just take those dollars and run.
Yeah. And that's what you actually went to where my brain was, which is a lot of the places that you see are owned by someone else, and they're working for someone else. So I was curious, since you have the consulting side, what you were seeing also. So as far as going back to the practice side of it, what are some of the biggest patient challenges you typically see in your specialty?
I think about insurance probably is the number one thing. When I got out of school 27 years ago now, we would laugh because in the US, it was pretty much just cash-based business. And in Canada, they were inundated with insurance. It was just, you would not want to go to Canada to practice optometry if you could. Now it's completely flipped. Most practices we work with are 80 to 90% managed care. We have medical providers that provide, Blue Cross and United Healthcare and all the ones you can think of. And there's a lot of vision plans, and tends to be that the medical plans are what people pay for, and then they just tack on for cheap the vision plan. And so, there's the discussions. We have pre-authorization. So we have somebody who full-time, they just call for pre-authorization for insurance. In the exam room, we've got so many clicks due to insurance issues. And so we have scribes that dictate, take down all the notes and everything because we want to have a good connection with our patients. So in Canada now, they got cut out of national healthcare 10 or 15 years ago, and it's like 99% cash-based now. So the Canadian optometrists are loving it, and they're laughing now at the US doctors. But I would say that's probably the number one thing is the patient challenge is really the lack of understanding and the disconnect between I have this plan that covers everything, and really they have a discount plan. Yeah. We did a study of one of our vision plans about 2 years ago, and we found that out of all the dollars we collected over the year from this insurance plan, 73% came out of the patient pocket. So you think it's such a discount for the patient, but it's actually not that good of a deal. And so that probably is a lot of the issue with patient challenges.
And how you mentioned this, and it was one of the things that popped to mind. What are the staffing requirements just to deal with the insurance?
Great question. We have 35, we bought a location in January, actually a satellite practice about 15, 20 miles away. We have 35 staff members. I would argue if we had no insurance, we would probably go to half of that.
Wow.
So they're not all directly related to say I'm filing insurance, but if you think of all the nuances and all the extra clicks and frankly, you think about meaningful use and HIPAA and all the other compliance issues there too. There's so many things involved. So, that's a guess, but I would say maybe half.
And do you have, and there are other markets that, and other specialties, that allow, if I decide to go out of network, I'm going to go out of network. And if the patient wants to come here, and great, but is that still allowed? Like, is that something you're seeing that some providers are trying to go Canadian basically?
It's say, right. Yeah, exactly.
I don't accept it anymore.
Yes, it's allowed for sure. I'll tell you a story is that about 4 years ago, we did a startup in the Dallas area and we did vision and hearing together. And we took no vision plans or no medical plans. We wanted to test a model and make it very pure. Well, what's really hard is when somebody has an insurance plan, and we weren't established, by the way, but if you go to Clarke Eye Care, my main practice, and we have somebody that says all the time we get them, they say, oh, I'm glad I could come back to you because you're on my plan now. And they could pay out of pocket and come to us. We have a cash price. They could go either out of network or pay cash. But the reality is we used to say, do your best you can, do the best, customer service, and they'll come to you. The reality is people want to use that plan, even if it's not worth that much to them. The perception is, we believe, which is pretty frustrating.
Yeah.
But, so there are some people, actually, there's people that I had an email from somebody just the other day, a friend of mine, they were like, what do you think about dropping vision plans? And this is going around our industry a lot. I think it really depends on what you want out of your business. I want my business to not be dependent on me. So we need patient volume. So I'll take the vision plans and then convert them to other things that we do within our practice that are more cash based. And so to me, it's a little bit of a loss leader, not complete loss, but kind of. If we took only vision plans and nothing else, you probably wouldn't make any money. You probably couldn't make it. And so, you really have to, if you just took what the vision plans paid you, is what I mean.
Right.
Somebody can come in and buy extra, but
that's amazing. So, and I'm going to transition. And what I love about your perspective is, as a coach, you're not just seeing Clarke Eye Care pain points, you're seeing the industry's pain points. And this, you could probably answer the next question with insurance as well, but what are, other than insurance, some of the biggest business challenges in optometry?
Yeah. So as far as business challenges go, and I'll go back to what I said from the start, is the staffing issue. And you guys know staffing has gone, and that's why I said that, is that you think about it, this has been since I've been, 16 years old with my dad working on his business. It was about staff. And if you come to today, as you guys know, post-COVID, it's even more about staff. So we travel around the country and we hear all the time, well, in my area, I can't find good people. What we find is that everybody's the same. It doesn't matter, if you're in a big city or a small town, businesses are not that different. And we really think it's about creating the sticky factor within your organization, and really about caring more about, not that people don't care about those people, but putting systems in place to help develop them. But when in the business challenges, I would say would be staffing, number one. And in our profession right now, one of the biggest business challenges is that insurance, and you're inundated with all these extra things we have to do. We're not really set up to have a bunch of managers in the business. We've created, with 35 employees, we have a director level. So we have, 4 managers within the business. Well, most optometrists, like Brad was alluding to earlier, smaller, and they have the owner, maybe a manager. Well, they're all in patient care all the time. And it's hard to work on your business when you're in the business. And that's how our business is set up. Hence, you get the private equity firms that come in and say, I'll give you 6 to 8 times EBITDA on your profit, on your EBITDA right now. Give it all to you up front. We'll take care of everything and you can walk away. Well, what's happening is then they're taking over. It becomes corporate America. Teams don't like it. It messes up the culture, and they're going to be out of this and sell it to somebody else in 3 to 5 years. And so that's the biggest challenge in our business right now, is it's hard, and there's this enticement of cash. And we see, a risk for private practices remaining long-term because of this.
Man, it goes back to, you said it, working for the corporate side versus the medical side, which is a whole nother challenge on its face. But that kind of leads me to, I guess, the last question that, I was thinking of for this was just, in your specialty, you kind of allude a little bit to this at HIPAA, but what's the biggest healthcare compliance challenge that you guys have in your specialty?
Yeah, when you get to healthcare compliance, and you guys know this better than anybody, but with HIPAA to meaningful use through Medicare, and then we get into those terms like MACRA and MIPS, and I'm like, oh my gosh, it makes my head spin. And, all these things, and we want to do things right. And so there's these practices that go, I'm not doing meaningful use, and they just, they haven't even gone to electronic medical records and whatever, but we try to do everything the best we can and keep it as on the up and up as we can. And so about 5 years ago, I ended up, kind of as an insurance policy, I was like, told a group of friends, we were at a meeting on a Sunday, and I said, hey, there's this idea I have, and I really want to hire a compliance officer because I don't know how to do this. I don't know how to do it. You can outsource it to some people, but still, even your liaison in the office who's working with the compliance company, because there's all these compliance issues. It's like, how do we manage that? Literally, my second patient on Monday came in and I said, what do you do? She said, I'm a compliance officer. And I subscribe to this philosophy of, you dream of what you want, put it out there in the world, and then the world conspires to make it happen, kind of Emerson quote, right? And so it was the craziest thing. And I didn't offer her the job. I just said, can you help us? Well, 3 days later, she came back to buy glasses and said, I want to give you my application. And she's been there for 5 years. And, my point to others is kind of like, if you have a compliance issue and you're not the one who's, going to be the best at that, figure out a way to let somebody help you. And so she spends 30 hours a week. And what's nice about it is instead of us being reactive to the compliance issues, because as you guys know, something else is going to come up. It's not like the government or somebody or insurance companies are going to say, okay, it's set. Something else is going to come up. So she can be proactive and watch videos and get in chat rooms and figure out kind of what's the next thing and keep an eye on that for us. And I look at that as kind of just an insurance policy for.
And yet you brought it back to people again.
It's always about people. It's always about people. You know, Brad, it's funny you say that about people, but I'm telling you what I've figured out in the past 6 months to a year is I always felt like I want to develop people. But what really is if we can develop people who are into developing people, that's when it really becomes magical, because I can say I want to develop people, but when I've got an organization of people that want to develop the next person, that's when it makes a big difference. And we can step back from our business and just watch it grow and watch these people grow. But I really do think it is all about the people.
That's known as the force multiplier.
Yeah.
Love it. And I feel like we need to read this book, the E-Myth.
That's so, Danny, that is so funny because we literally just heard this comment from someone else and neither one of us heard it. And we actually just bought it on Amazon yesterday.
Yeah, okay, nice. I've got it right here. It's impactful. I'm telling you.
Awesome. Well, we have reached our time. It went by fast. Really interesting. We're grateful, Danny, for you to join us. Grateful for our relationship with you. What we'll do next is go into a commercial. And on the other side, we will give a little legal insights to wrap up the conversation today. Thank you.
Thanks, guys. Appreciate you having me.
Absolutely.
Many business owners use legal counsel as a last resort rather than as a proactive tool that can further their success. Why? For most, it's the fear of unknown legal costs. ByrdAdatto's Access Plus program makes it possible for you to get the ongoing legal assistance you need for one predictable monthly fee. That gives you unlimited phone and email access to the legal team, so you can receive feedback on legal concerns as they arise. Access Plus, a smarter, simpler way to access legal services. Find out more. Visit ByrdAdatto.com today.
Welcome back to Legal 123s with ByrdAdatto. I'm your host, Brad. I'm still here with my co-host, Michael Byrd. Now, Michael, this season, we've been really working on the specialty spotlight. We had, Dr. Danny Clarke came on, and what an amazing, we were both got pulled into so many different stories he had about him just obviously running his own practice, but then also based on working and consulting with other practices. And at some point we did start talking about the creep of private equity in this specialty, and that optometry is seeing like a lot of areas. And obviously we've had private equity on in our past season, talk to them about what's going on. But I think for our audience, we want to hit that pause button. And I know we've talked about corporate practice of medicine in several other episodes, but I think they should understand, just like a lot of areas, there is such thing as corporate practice of optometry.
Yeah, and it's a great, with this being a specialty spotlight, to just understand from a legal perspective that if you have a license to do something, anything, if you're a license to be a lawyer in a state, you have rules that go into what that can look like and who can own a business that practices that particular profession. And so you always have to check that when you hear about non or business people in a particular profession coming in. Usually we say it in terms of private equity, that it's workable. And the corporate practice of optometry in Texas, for example, is really strict. It's actually more strict than the corporate practice of medicine or the corporate practice of dentistry. And essentially, just to kind of reset, what is a corporate practice doctrine? It's this idea that says, if you're providing these types of licensed professional services, then only people that are so licensed can own those businesses.
Yeah.
And in optometry, it's no different, except they also add in Texas some special add-ons, like a limitation on the number of locations that you can own. So you, even though you're an optometrist, are limited to 3 locations. And when you think about private equity coming in, you have to navigate that because they want to scale, right?
Yep.
And then the other aspect of it is they in optometry, they really talk about control.
Mm-hmm.
So it's not just ownership, it's control of the practice. And so what do I mean by that? Well, it's one thing to say, okay, you optometrists are going to continue to own it, but I'm going to do a management services agreement for my company, and I'm going to operate your practice. Well, it's real easy in optometry to overstep the line and be in violation, even though you own no part of the optometry practice.
Yeah, and that reminds me a lot of back in the day with dental support organizations, where there are a lot of restrictions about what they could and could not do over a dental practice. So I think for the audience's perspectives, just understand, of course, every state's gonna be different on that. But the point is, just because you've flipped it and done it over and over in one type of specialty does not mean it's going to follow that same suit.
Well, Michael, again, what another phenomenal episode. But unfortunately, audience members, we got to move on. Next week, we're going to have another specialty spotlight on dermatology with Dr. Paul Jared Frank. Thanks again for joining us today. And remember, if you like this episode, please subscribe, make sure to give us a 5-star rating, and share with your friends.
You can also sign up for the ByrdAdatto newsletter by going to our website at ByrdAdatto.com.
ByrdAdatto is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Reference to any specific product or entity does not constitute an endorsement or recommendation by ByrdAdatto. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Please consult with an attorney on your legal issues.